show you guys on the crash cart. So this is our defibrillator. Make sure everybody gotta adjust a little bit. So this is our defibrillator, and so these are the 3 leads we were talking about going on the patient. So patient comes in like they're in the emergency room and there's something going on. So we're gonna put 3 leads on the patient originally. So you guys need to understand the distinction between a 3-lead ECG monitor and a 12-lead. So a 3-lead monitor is putting them on the monitor on the wall in the room. Every patient in the ER, in an ICU, telemetry where they monitor their heartbeats, any of those patients are going to be on that kind of monitor. So it's pretty much standard procedure when coming into the ER. Patients that need a check on their heart themselves get a 12-lead EKG. So a 3-lead monitor is to get the monitoring, which would come up on here. So when they first come in, we put 1 here, 1 here, 1 here, and then if there's green and white, they go over here. Green and white. Usually there's a green, it's just a grounding one. So we say white to the right, and remember it's the patient's right. So white to the right, and you would just snap it on. Smoke, the gray or black over fire. So this is here, and the red's down here. And so that's how everybody remembers it. White to the right, smoke, gray, over fire, red, which goes down here. And then this will come on, and so what happens is if you need to defib somebody, so we turn this on. I don't have it hooked up, so it's not gonna. But so let's say that this was a rhythm and we wanted to defibrillate the patient. Then we're gonna click over here to defib. So what rhythms need defibrillated? Just talked about.
Defib.
Not AFib. Defib. VFib needs defib. Patient doesn't have a pulse. Is it an emergency?
Yes.
Yes, it's absolutely an emergency. So the pads, here's other pads too. These also have pictures on them. So you'll see the purple one goes here and one goes here. So you'll hook those up. Now we're gonna defibrillate. We're gonna go all the way over to defib because this is for a patient without a pulse. So remember, there's nothing to sync to. We don't have a heartbeat that we're gonna worry about. So just for now, I mean, you don't have to live the whole machine right now, but defibbing is for our patients. VFib, VTAC, and they don't have a pulse. We would increase our energy here, which for defib, for the record, we do the whole thing. Then we would charge. Once it's charged up, what do you say? All cleared.
Yep, and no one put your hands up.
Yep.
Thank you.
Not like in class when we tried to defib me. Super important to put your hands up. All clear, and then you would shock. Shock delivered. And then you would wait to see what was on here. Did they come out of it? Are they still in it? And then continue compressions. Now the difference is cardioversion. You're still gonna go over here to defib. We use a smaller amount because the patient's not in a cardiac arrest right now. We're trying to get that abnormal heartbeat stopped and corrected, right? So the big difference is you have to sync because it's gonna sync to the patient's rhythm like she was talking about. So you hit the sync button and defib changes to sync. So we're syncing and cardioverting at a patient with a heart rate that needs to be, that's unstable because they have a low blood pressure or whatever, and we need to get them out of it. Defibrillation, we're doing for patient without a pulse and nothing to sync to. Does that make sense?
Do we not use the little
Not
things anymore?
Well, we can, they're right here. But
Why does it know in the
yeah.
hospitals if you use them anymore, or do you
Yeah.
just use the pads?
No, you use them. That's how you get the shock delivered. But
Oh, I
we
thought it
just
was
don't
the
go that
pads.
far. No, you put those on there.
Oh, okay.
So 3-lead, put on the monitor. 12-lead, checking for heart function. The AED, patients found down outside of a medical facility, checking for defib so we can shock them. Defib for a rhythm that doesn't have a pulse, VFib or VTAC. Cardioversion for a rhythm with a pulse, and you must sync to it. So those are your differences that you'll need to know. Okay? But who had a question back there? Somebody? No? Oh, yeah.
It's also in joules, right?
Yes, Jules. Yes?
And you said sync, what does that mean? Like, it's a
You're
test?
syncing, no, there's a patient has a heartbeat.
Okay.
So in order to not mess up that heartbeat to throw it into a VFib or something like that, you can't just give the shock at any point when someone has a heartbeat. You want to sync it to when it's on the QRS, basically. That's the right time to do the shock. And so when you sync it, you're saying sync to that and make sure you shock appropriately, because the patient does have a pulse. Because all we want to do is try to stop that abnormal rhythm and have it go back into a normal rhythm. With Defib or VTAC, there's nothing to sync to, because it's just all waves and there's no QRS. So that's why we just, like she said, it's a room full of people and you're trying to get it to stop. So you're like, shut up, stop the beat. We need it to get back into normal. Okay?
Is this machine portable? This one is
Oh
portable?
yeah, we just take, this is our crash cart. So if somebody goes into a code, we just bring the whole thing over. Code or is unstable and needs extra attention, this is what they get. They're red, every crash cart is red and has all this stuff on it, but we'll learn more about that as we go on.
After you did all these procedures, what next you should do?
It depends. If the patient comes out of like SVT and gets stabilized, you're probably gonna send them home, especially if they've had it before. They may be kept for observation. It's gonna be very patient dependent on what you do.